Hanato Godfrey is nursing her third child, who's just 4 months old. She says she always gets her children vaccinated against preventable diseases in children.
Nurses told me about child immunization during antenatal care, and I can attest that it's a good thing. It prevents ailments from getting to children, and even if they're attacked, the effect is minimal and recovery after treatment is faster.
But unlike Hanato's children, many children in Nigeria are missing out on vaccines. The United Nations says 2.2 million of them, representing 30% of the children in Nigeria, fall in that category.
It's a myriad of problems ranging from infrastructural problems, from cultural issues, religious issues, lack of awareness. A lot of places, times, these vaccines are not available. Even when people desire them or want them or need them, you don't find them available. Looking at the infrastructural problems, the health sector is underfunded. You know, we expect that it should be at least 25% of the national budget, but what we have in Nigeria is just 5%. So there's a funding problem. A lot of people were not invested in the infrastructure of the health system. So there is unavailability of vaccines.
According to the United Nations Children's Fund, UNICEF, Nigeria represents less than 2.5% of the world's population, but accounts for 10% of the global burden of infant and child mortality. A drop in immunizations is part of the problem. 1 in every 15 Nigerian children dies before reaching the age of 1, while 1 in every 8 does not survive to their 5th birthday. Health experts in the country are calling on the government to improve infrastructure and the provision of vaccines and funding of the health sector.
These vaccine-preventable diseases they constitute a major bulk of the causes of morbidity and mortality particularly amongst under 5 children. And most of these disease conditions, diarrhea disease, tuberculosis, these are problems that can be vaccinated against. The government needs to be invested more in the health infrastructure and put in more money, put in more infrastructure so that they can aid the delivery of these vaccines. We need to build structures, facilities that can hold this immunization or vaccines. Because, I mean, so many places, especially in the rural areas, you cannot even store these vaccines appropriately. So even if you carry them to those places, they will get spoiled, they will get expired, and you can't even use them.
The government says it's doing all it can to improve immunization for children. The government says it's chartered the implementation of the Accelerated Action for Impact Plan in 2021. This is in partnership with the European Union and the Gates Foundation to collate data, analyze gaps and bottlenecks in demand and supply of vaccines across the maternal and child circle in the country. The target is to ensure 90% vaccination of children in Nigeria by 2030, in line with the Sustainable Development Goals. Such efforts should lead to more children in Nigeria like Honato's being vaccinated, thereby saving lives. Tassim Akende, CGTN Jos.